Well, in order to find the right concierge doctor, you need to do a meet and greet. It is very important to do that. Meet and greet is where you're going to meet with a physician and actually be able to interview the staff and see the office and so on. So in my clinic, we offer a free meet and greet. So it's a 30-minute visit where we get to know each other to make sure that we click and that we are a good fit. And they will actually get to meet our staff and tour the facility and figure out what we actually do in the clinic. From a medical standpoint, most of us are all the same, but it's the atmosphere and the vibe of the office and the personality of the physician and the staff that you want to make sure that you click with. So during the meet and greet, some of the questions that you should ask are, how often do you schedule your patients? That's one. Two, what is involved in your executive physical? First of all, do you do an annual executive physical? If you do, what is included in all of those? And three, how long have your staff been with you? Because you don't want a clinic where the staff changes all the time. Obviously, then they don't know who you are. And so it's like when you come to the office, like starting all over again each time. So you want to make sure you find out how long the staff have been with a doctor. Hospital coverages. Ask the physician, do you actually see the patients yourself in the hospital, or do you have a coverage? In my clinic, I used to see my own patients, but nowadays it is very difficult to do that because of the insurance. So I would imagine it's kind of the same with all the other clinics, because we have to use the hospitals that are designated by the insurance. Because of that, I will actually make a social visit. So find out whether that physician makes a social visit to the hospital because if I make a social visit, I can talk to the physician who's in charge of the patient care in the hospital. And two, I actually get to know what's going on in the hospital so that when the patient gets discharged and comes to the office, I know exactly what's been going on. So transitional care is much easier that way. You want to also ask, do you have coverages after hours or on the weekends? Do I get your cell number? So those are some of the questions that you want to ask. And of course, you want to ask what the membership is, how much it is. I hope this was helpful, and I will see you in the next episode. Thank you.